Many women assume that if they take good care of themselves and eat right, certain health problems won't happen to them. Here are some scary diseases that can affect any woman, no matter how healthy she is. 7. Endometriosis. This is a condition in which the tissue similar to the uterine lining grows outside the female reproductive organs. It can cause pain, especially when you have your period or during sex. If you're experiencing this type of pain, it could be endometriosis. There is no cure for endometriosis, but there are treatments available that can lessen the symptoms and improve your quality of life. Unfortunately, endometriosis can lead to infertility in some cases. If you're trying to get pregnant but aren't having any luck, endometriosis might be the culprit. Luckily, there are ways that you can increase your chances of getting pregnant with this condition. See your doctor for more information. Number 6. Polycystic ovary syndrome. Polycystic ovary syndrome, or PCOS, is a hormonal disorder that affects women in their childbearing years. Women with PCOS may have infrequent periods, more facial and body hair due to high male hormone levels, and cysts on their ovaries. Many women with PCOS also become resistant to insulin, which is a hormone that regulates blood sugar. This means that women with PCOS are at an increased risk for developing type 2 diabetes and cardiovascular disease. The good news is that you can lower your risk by making lifestyle changes, such as eating a balanced diet and exercising regularly. If you think you might have PCOS, see your doctor for a diagnosis and treatment plan. Number 5. Ovarian cysts. Ovarian cysts are fluid-filled sacs that can form on or inside an ovary. Most ovarian cysts are benign and go away on their own within a few months. However, some ovarian cysts can be cancerous. Symptoms of ovarian cancer include abdominal bloating, pelvic or abdominal pain, and difficulty eating or feeling full quickly. If you experience these symptoms, see your doctor right away. Treatment for ovarian cancer depends on the stage of the disease. Early-stage ovarian cancer can often be treated with surgery or chemotherapy. More advanced ovarian cancer may require more extensive treatment. Number 4. Uterine fibroids. These are non-cancerous growths that can develop in the uterus. They can cause heavy menstrual bleeding, pelvic pain, and frequent urination. In some cases, uterine fibroids can make it difficult to get pregnant. However, most uterine fibroids are benign and don't pose a serious health risk. Treatment options include watchful waiting, medication, and surgery. If you're experiencing symptoms related to your uterine fibroids, talk to your doctor about what your best treatment options are. Endometrial cancer occurs in the tissue that lines the inside of your uterus. It can cause abnormal vaginal bleeding, pelvic or abdominal pain, and a lump or mass in the pelvis. Risk factors for endometrial cancer include obesity, diabetes, and a history of breast cancer. Endometrial cancer is most common in women over the age of 50, but it can occur at any age. If you're diagnosed with endometrial cancer, your doctor will determine the stage of the disease. Treatment options include surgery, radiation therapy, and chemotherapy. Number 2. Breast cancer. Breast cancer is the most common cancer in women, affecting 1 in 8 women in the United States. Although breast cancer can affect anyone, your risk increases with age. Other risk factors include having a family history of breast cancer, a personal history of breast cancer, and certain genetic mutations. You can reduce your risk of breast cancer by making healthy lifestyle choices such as eating a balanced diet and exercising regularly. Early detection is key when it comes to treating breast cancer effectively. Be sure to see your doctor for regular mammograms and clinical breast exams. Number 1. Heart disease. Heart disease is the leading cause of death in women, accounting for 1 in 5 female deaths each year. Heart disease can cause chest pain, shortness of breath, and a feeling of impending doom. Risk factors for heart disease include high blood pressure, high cholesterol, and diabetes. You can lower your risk of heart disease by making healthy lifestyle changes, such as eating a balanced diet and exercising regularly. Be sure to see your doctor for regular checkups so that they can monitor your risk factors and provide you with the care that you need. Did you know that heart disease is the leading cause of death in women? It's true. And that's why it's so important for all women to take steps to protect their heart health. One of the best things you can do is make healthy lifestyle choices such as eating a balanced diet and exercising regularly. But even if you do everything right, you may still be at risk for heart disease. That's because there are certain risk factors that you can't control, such as your age, sex, and family history. For example, women are at higher risk for heart disease after menopause. And women with a family history of heart disease are also at increased risk. If you have any risk factors for heart disease, be sure to talk to your doctor about ways that you can reduce your risk. It's also important to be aware of the signs and symptoms of heart disease. These can include chest pain, shortness of breath, and a feeling of impending doom. If you experience any of these symptoms, don't hesitate to call 911 and get help right away. Heart disease is a serious condition, but it's also one of the most preventable conditions out there. By making healthy lifestyle choices and being aware of the warning signs, you can protect yourself from this deadly disease. Now let's talk about what you can do to keep yourself safe from these diseases. First and foremost, you should always be aware of your body and pay attention to any changes. If you notice anything unusual, be sure to see your doctor right away. Don't try to ignore it or hope it goes away on its own. Early detection is key when it comes to many of these diseases. The sooner you catch something, the easier it is to treat. Another thing you can do to keep yourself safe is to make healthy lifestyle choices. Eat a balanced diet full of fruits, vegetables, and whole grains. Exercise regularly and get plenty of rest. These basic things can make a big difference in your overall health and reduce your risk for many diseases. In addition, you should also be sure to follow the recommended guidelines for cancer screenings and preventive care. This includes getting regular mammograms, pap smears, and colonoscopies. These screenings can help detect any potential problems early on, so that you can get the treatment you need as soon as possible. Finally, don't be afraid to speak up and ask questions. If you have any concerns, be sure to talk to your doctor. It's important that you feel comfortable and informed when it comes to your health. So don't be afraid to speak up if you need clarification or if there's something you do want to understand. Remember, knowledge is power. The more you know about your body and the potential risks, the better equipped you'll be to take care of yourself. Don't be afraid to take charge of your health. By following these tips, you can help keep yourself safe from some of the scariest diseases that affect women. Stay healthy, stay informed, and stay strong. Are you concerned about your risk for any of these diseases? What steps are you taking to stay healthy? Share your thoughts in the comments below. We would love to hear from you. If you found this video helpful, please like and share it with friends and family who might benefit from the information provided. Don't forget to subscribe to our channel for more informative content about women's health issues. Thanks for watching, and we'll see you next time.